The scope of digital automation platform is to automate data capture from fax, exception workflow, for the provider agent for adjudication. This is followed by posting to the simulated ABC third-party system. The fax from provider prior authorization is to be submitted to ABC. Please note that key information is blacked out for HIPAA compliance. Our scope is to digitally automate data capture of provider and patient information. Let us begin automation. Fax user uploads fax in the workflow. The actual fax will be integrated. The robotic capture is completed, and the analytics shows that there is an exception, and the fax document is moved to query back automatically. Let us audit the transaction. Fax user selects the transaction, provider information is captured, and we can experience the highlighter of the key index fields. We can watch that robotic lens highlights on last name, first name, and pay, address, etc. Patient information is not captured by the platform as the information is blacked out for HIPAA compliance. To simulate compliance, provider fax user enters the patient demography manually and routes to the provider agent. You can watch that email ID has been missed out intentionally while routing to the provider agent. Watch. The email ID was missed, and automation has stopped by the fax user for exception to fix. Post data capture exceptions. Fax user will be routing to provider agent for further adjudication process after audit compliance. Fax user now signs out. Provider agent gets an alert over email and securely logs into the digital platform for further adjudication. You can also see the audit trails of activity assuring compliance on exceptions handled so far in the platform. Digital Intelligent Agent automates the exception for compliance by matching 10-digit NP number and provider name by lookup. Let us assume NP's last digit is captured as 7 instead of 5 and routed.
Agent audits the exception and routes for adjudication. This is an example of lookup automation on third-party systems for compliance. Post-audit, let us observe the exception, forcing the compliance of Hethi AI and provider name to match.
Now the agent corrects the NP and name value as per standard operating procedure and routes to ABC third-party system post-audit compliance. The output robotics automation now takes control to auto-populate the simulated ABC system. We can see that digital robotic output automation auto-populates to the simulated ABC system for further exception. As we can see, all the index fields of provider and patient information post data capture and adjudication by agent posted to ABC system. Output robotics can be scaled to multiple third-party systems. To summarize, the digital platform automating data capture from fax, exception workflow, for provider agent, automated posting to ABC system by output robotics, transforming improved productivity with quality and compliance. Thank you.